Hi, I'm Dr. Mark Olson, and I'd like to invite you to attend my class on trauma-informed care, which is a class that is all about teaching about what trauma is from a neuroscience perspective, and more importantly, what kinds of relational skills we need to develop to optimize our relationships, whatever relationships we have. Professional relationships, personal relationships, all of it. So I'm the director of the Pacific Center for Awareness and Bodywork, which is a massage therapy program on the island of Kauai. I've worked as a spa director, I've worked as a neuroscientist, I've worked as a licensed massage therapist, I've been on school boards, I've been in community organizations, and what all of these roles have in common is that they all have better outcomes if the relational skills are well tuned. If relational skills aren't there, there's going to be something missing. There's going to be an impediment to whatever it is that we're trying to do. So this class is for everybody for that reason, because relational skills are relevant across the board and trauma is relevant across the board. But if you're a healthcare professional, or if you're a manual therapist, or you work as office staff in any of those settings, this class is especially relevant to you because trauma and relational skills are even more important in those settings. So why would you want to take this class? Well, one, it's going to help your bottom line. If you think about times where you've gone to a professional like a doctor and they may have had great skills medically, but they didn't have great relational skills, maybe you didn't really feel like going back to see them, or even if their office staff didn't have great relational skills, you might not have felt like going back, but maybe you had to because they were the only person with those skills medically, or the only person who took that insurance or something. But with massage therapy, they can go somewhere else. So you don't want to be that person. You want to get those referrals, you want people coming back. So if they feel safe, if they feel like you care about them in ways you really meet them, then that's going to highly increase the likelihood that that's going to happen and increase your bottom line. Secondly, you're going to have better outcomes with your clients. If they feel safe and cared for and met by you, the more that's true, the more safe they feel. Neurochemistry is going to be different. Autonomic responses are going to be different. That's going to change ultimately the outcomes in regards to their pain levels, which is probably why they're there in the first place, and also anxiety. So that's going to make a big, big difference. Lastly, your outcomes are going to be different in terms of your workplace. I mean, who doesn't want to have a better work environment? Even if you have a great work environment, you could probably imagine one that's even better, but a lot of us have work environments where we could easily imagine a better work environment. There's somebody or a couple people that you just don't know how to engage with effectively, and they don't know how to engage with you effectively. So it's just not as pleasant of a situation as you'd like to have. So learning better relational skills is going to increase the likelihood that your work environment's going to be better. So what are we going to do to achieve this? Well, we're going to learn all about trauma and trauma-informed care. We're going to dive into the effective neuroscience of that, the somatic psychology of that, attachment theory of that, and those are all things that I could talk about all day. I have a PhD in neuroscience. These are topics that I love to talk about. But we're not going to just talk about them. We're going to dive in and really learn about them from the inside out, so you really have the skills. It's just like any skill. If I just told you about how to play basketball or how to ice skate or how to swim, that you wouldn't learn it that way. You actually have to practice it. So relational skills are the same way, and unlike basketball and swimming, none of us ever got lessons on how to do relational skills effectively. We just learned them, from our family, which wasn't always the best way to do it. So learning relational skills is so important in all settings, and even if you are pretty good with it, there's no end to getting better. So I hope that this sounds interesting and meaningful by diving in and learning it this way and not just in an academic way. It's much more interesting, much more meaningful, much more exciting. So I hope that this sounds interesting to you and you come and join our class. Thank you.